News Talk 760 WJR is proud to present Women Who Lead. Profiling great women impacting the Great Lakes with WJR's Ann Thomas.
Welcome to part 2 of Women Who Lead with Nancy Schlichting. Nancy is the CEO of the Henry Ford Health System, and she's got great advice for us today.
And the hours are different too. I mean, if you're going to be doing hospital work, you have to be somewhat flexible in what kind of hours you're willing to work, right?
Yeah, I think initially in your career that's very important because, you know, like in anything, you have to climb the ladder. And when you get started, you have to be very flexible, very open. Ultimately, though, you know, the career offers a lot of options. For example, nursing. You know, people think about nursing and working midnights and working weekends. But, you know, over time, you get, as you have seniority in an organization, you get better schedules. And today we try to accommodate most people's needs because everyone's balancing family and work life, and we have to be very accommodating to the extent that we can to help people with their lives. And I think, in addition, over time, many of our bedside nurses end up going into other types of nursing, whether it's home care or even working for our health plan. We have a lot of nurses that work for HAP, so it really can be very broad. And I think especially juggling family lives and coming in and out, maybe on a part-time or full-time basis, actually nursing and many of the health careers offer more of that than other professions do. And I think it's a very positive environment for that.
Now, as a leader and somebody who is responsible for thousands and thousands of employees, what kind of employee impresses you the most?
Well, it's a wonderful question. In fact, we have young administrators that come to us for fellowship programs. And we talk a lot about career and how you interview and what you do. And, typically most people have the credentials if they're applying for a given job. But what separates one person from another is often their attitude, their energy, their passion, their communication skills. I always tell young people, don't be afraid to sell yourself because no one else does it for you.
Exactly.
You have to be the one.
And they don't get that, though. That's a tough thing for them
I agree.
to understand.
I agree. And I think it's tough for anybody that tends to be, relatively modest about their own ability. Right. And they expect that, they write their resume and that's enough. But, we just are interviewing now for our West Bloomfield Hospital. We have about 25 management positions. We got 1,000 applications.
Oh, my gosh.
So, you have to be able to differentiate yourself. And typically the way you do that is how you interview, how you come across. And in fact, when I was young, I was a high school debater. And I've always thought that those skills of speaking on your feet, being able to articulate your thoughts clearly, is one of the most important attributes somebody can have going through life. Because, we all have, trips and falls periodically. We have to get up again and look at ourselves. And particularly in this market today with people having to think about a new career because of just the economy changing, it's hard. So if you can do that and you can get out and sell yourself a little bit in terms of how you're looking at your skills that you gained in another profession and how you're going to transfer them to, say, healthcare or some other field, you have to be able to do that. And I do think sometimes people sit back and think, well, I'm good and, I should just get the job. But it's not that simple.
It does not work that way in this economy. One of the things that is interesting about what you're saying is we're in the years at my house where we have the teenagers looking at colleges. So I've been listening to different college presentations.
Right.
And one of the things that the college counselors are saying to parents and students is exactly what you're saying about the idea that a liberal arts education, or at least focusing on the areas of communication, public speaking, being able to be a good writer is key. Even if you're interested in being a doctor or you're interested in being an engineer, they're actually saying to some of these kids, go ahead and get a liberal arts degree first. And then once you have that and you have those skills, you can then, fine-tune it.
Yeah, absolutely.
Do you agree?
Yeah, I'm a big believer in that. And, it was, my background was basically a liberal arts degree.
Sure.
And at the time, I started as a chemistry major. In fact, I changed my major 4 times because every course I took I thought was fabulous. And so then I wanted to major in it.
And that's okay to do.
Right. And I was lucky my parents kind of said, Nancy, whatever you think. I mean, it's fine. Because my mom used to say she quit raising me in the 8th grade because I was very focused and driven. But the truth was that she recognized, because my mother had a liberal arts education as well, and she recognized the value of learning how to think, learning how to speak, learning how to write. And if you can do those things, critical thinking, analytical thinking, it gets you into all kinds of doors. I mean, we have our head of government relations who is terrific at her job. She was a Russian history major.
Wow.
Probably helped her think through all the crazy politics that goes on and how people maneuver and how they strategize. But the truth is, if you really look at most people's careers, what they started doing is not what they ended up doing. And in today's world, they estimate most people are going to change their careers several times. So if you have the fundamentals in place, you can be open to other learning that will allow you to gain the open door to some new aspect of your career.
Switching topics a little bit. In this election year, we're hearing all about health care. It's one of the major issues.
Right. Very important.
Very important. What do you think about the state of this country's health care?
Well, it's in some ways it's wonderful, and in other ways it's a total mess. Having been in this field for so long, today what I love about what we're doing is the strong focus on quality and service in healthcare delivery, and I think that is so needed. Care is so complicated today, and it's so important that we figure out ways to have our processes work better, have the patient experience and the family experience much more attentive to their needs. And so I've seen tremendous development over the years. We also do amazing things for people today. If you look at the over 65 age population, they have an ability to extend their quality of life in such an amazing way today based on what we can do for people, whether it's open heart surgery or it's some of the joint replacement or the medications that keep people in a very good state of health.
Curing cancer.
Curing cancer in many respects, or cancer becoming a chronic disease that is treatable over many, many years instead of being a death sentence, which it was many years ago. So there's a lot of progress, and I think sometimes we sort of cast the blanket over it and say, it's just a disaster. Well, it's not a disaster, but it is a very difficult situation right now from a public policy standpoint because, in this country, and we talk about it a lot, we're the richest country in the world, and yet we don't guarantee access to health care to every citizen. And that's a problem because certainly here in Detroit, we have a terrible situation in terms of the level of uninsured patients that we try to serve through our safety net of the Detroit-based health systems. But it's very challenging. I mean, we at Henry Ford in the last 6 months to a year, we've seen almost a 70% increase in uncompensated care at Henry Ford Hospital.
Wow.
That's a huge economic burden. Yeah. And we're seeing actually growth in uninsured in every one of our hospitals throughout the region. So it's not just the urban environment that's experiencing that. We're seeing it in the suburban environment as well. So it's very important that we figure out a way in this country to provide access to care. That doesn't mean a single payer system. It doesn't mean the government has to control every aspect of it. If you look around the world, there are different models that I think we can learn from. And we do need to provide that access, though, because it would actually save money, I think.
Sure. In
the sense that if you have more preventive care, primary care for people like they do in England, you tend to actually reduce the demand on some of the more sophisticated care because people have a better health status and they can sustain it longer if they have primary care access.
You've been listening to Women Who Lead with Ann Thomas. For more interviews and podcasts, visit WJR.com.